While many genetic conditions may explain the cause of a person's symptoms, it is important to note that autism and intellectual disability are clinical diagnoses, which are made based on features, behavior, and development. Since genetics often contributes to the development of autism spectrum disorders, intellectual disability, or developmental delay, genetic testing is frequently ordered to help providers and parents better understand what is causing these symptoms, as well as whether a child is at risk for additional health or developmental concerns. A genetic diagnosis can help healthcare providers, therapists, educators, and families to better tailor care. Some parents and providers feel a child is borderline and may have some features of autism or a developmental disability. A genetic test may explain some of these features, but won't necessarily confirm that a person does or does not have autism or intellectual disability. In some cases, having a genetic diagnosis may qualify a person for additional therapies or services. For people with autism or a spectrum of intellectual and developmental disabilities, the American College of Medical Genetics recommends a test called chromosome microarray also known as CMA, as the first step to look for a genetic cause. This test is designed to look for pieces of extra or missing genetic information and can identify hundreds of genetic conditions. CMA finds extra or missing pieces of genetic material about 30% of the time if someone has one of these symptoms. In some cases, results are clear and a diagnosis is made. In other cases, a result may be rare and we may not know if it is contributing to a person's symptoms. There are types of genetic changes that could contribute to autism and other developmental symptoms that would not be detected by CMA. For example, small spelling errors in a gene that can lead to symptoms are detected by a different type of genetic testing called sequencing. In many cases, having a diagnosis of a genetic condition can give medical providers information needed to personalize care for a child. Some genetic conditions that cause autism or developmental disabilities can also increase the risk for other health concerns like seizures, heart defects, vision or hearing loss, growth issues, and others. A person with a genetic condition will typically not have all of the features that can be caused by that condition, but may have a higher risk for these things than the average person. This often prompts evaluations with other medical specialists and sometimes additional types of screening tests and treatments. There may also be more appropriate developmental therapies for that child. The types of recommendations vary quite a bit depending on the diagnosis. A genetic diagnosis may also personalize information for the family, such as the chance for parents to have another child with the same condition or whether other family members may be at risk for health conditions. For example, take a 3-year-old girl with speech delay and a new diagnosis of autism spectrum disorder. She started receiving ABA therapy and speech therapy. Her pediatrician recommends genetic testing to determine if there's an underlying cause for her autism. The test comes back showing that she has extra genetic material, and this is causing a condition called 17q12 duplication syndrome. Now the pediatrician is aware of an increased chance for seizures, increased chance for a heart defect, or kidney or eye abnormalities. She can be referred to neurology because of the chance for seizures, cardiology to look at her heart, have a kidney ultrasound, and an eye exam. It is found that she has a small hole in her heart called a ventricular septal defect. Now the cardiologist can manage this small hole in the heart, watching to see if it's causing symptoms or closing the hole surgically if it does not close spontaneously on its own. No one would have known to do these things if they did not know about the underlying cause of autism, the genetic condition. If a genetic condition is found in a child, it may be inherited from a parent or brand new in that person, which we call de novo. Depending on the type of result, testing of other family members may help figure out if a genetic condition is inherited and potential health risk to other family members. Whether genetic change is inherited or brand new, it is not caused by anything a parent does or does not do. Sometimes other family members may have some of the same symptoms as the child, which can offer clues about whether a condition is inherited. Sometimes family members will have mild symptoms or won't have any symptoms at all, but they carry the exact same genetic change. If a genetic change is found in a child, the only way to know for sure if it was inherited is to test parents. This helps to clarify if there are health risks for other family members like parents and siblings. An evaluation with a medical geneticist can help make a plan for testing for a family.